I think we'll go ahead and get started. So, hello, everybody. Thank you for joining us this afternoon. Again, today we're going to talk about the behavioral health school grant funding, what it will look like this year. For this kickoff meeting, we'll talk about the overview of the grant, the guidance, what the process is for applying for the grant, for reimbursement, for the reports, some collaboration opportunities, and some frequently asked questions. If you have any questions as I'm presenting, feel free to drop a question in the chat or unmute yourself and you can ask a question. Otherwise, there will be time at the end to ask some questions as well. But I'm just here to help you with the behavioral health school grant funding. So any questions that you have, I hope to answer today. It's the overview. So first, I just want to talk. Well, I'm sorry, I should introduce myself. For those of you who don't know me, and I think most of you do by now, my name is Amanda Francis, and I am the Behavioral Health and Education Administrator for the Behavioral Health Division. So I've been helping with any behavioral health efforts in education. And when we talk about behavioral health, I wanted to be clear what we're talking about is that state of mental, emotional being, and our choices and action that affect wellness. And when we talk about wellness, it can be anything from preventing and treating mental health illnesses such as depression and anxiety, preventing and treating substance use or misuse disorders or other addictions, supporting recovery, creating healthy communities, promoting overall well-being. So really it is a broad spectrum of what behavioral health can be, and for the behavioral health school grant funding, promoting all of that wellness. And in the schools, we talk behavioral health is health. And so we know behavioral health is not the same as special education, but certainly there is a lot of overlap. So when you think about your efforts this year of what you want to help behavioral health efforts in your school, in your district, in your unit, just thinking about that overall wellness and how you can meet your behavioral health needs of your students. And yes, there's some overlap where some students who have behavioral health needs would also have academic needs and therefore qualify for special education. But when you look at that overall wellness, you see that many students need behavioral health support that don't fall under the umbrella of special education. So we want to look at across that spectrum. So the Behavioral Health School Grant is a sum of $1.5 million for the purpose of providing the behavioral health services and to support grants to school districts to address those behavioral health needs. And really the idea is to help fund programs or opportunities that you wouldn't otherwise be able to help fund because it's not for duplication or to be able to fund existing services. So really helping fill some of those behavioral health needs gaps. In order to be eligible, the school district must submit a plan to the Department of Human Services, which we will go over today how to do that, detailing that collaboration with school districts regarding behavioral health needs and behavioral health interventions. So when we look at guidance, you are able to find all the information that I'm sharing today on our website, and this will be uploaded there as well at our behavioralhealth.nd.gov education grant funding. If you click on guidance, you're going to see this information of how the grant funds can be utilized. So we have students without insurance. So the behavioral health school grants can be used to cover clinical behavioral health services for individuals that are not otherwise covered by insurance or Medicaid. It can also be used for clinical behavioral health services for students with insurance, but then the idea is that those services aren't reimbursable either because there's a service gap or a support gap in coverage. They can't afford the copay or their insurance doesn't cover clinical or support services or transportation costs to and from services that otherwise wouldn't be covered. So really filling in those gaps to be able to provide services to students that they otherwise wouldn't be able to get on any other means. It also is used to it is also used for prevention and early intervention services and supports. So it can be prevention and early intervention, and that means emotional well-being promotion curriculums, professional development training, sensory items, I'm going to go over some examples on the next slide of what that might look like what do I mean by emotional well-being promotion curriculums, but it's a lot of your SEL curriculums that you might be familiar with. And if it's a prevention and early intervention program, that would be reviewed and approved by the Behavioral Health Division prior to implementation because we want to make sure anything that you are using is evidence-based practice and that it is the best for students. Prevention and early intervention services can also include early intervention screenings and assessments. And again, while not reimbursable through other means. So what does that look like? I don't know how small this is on your screen, and some of you may have already seen this, but these are the summary of previous efforts. So last year, these are some of the things requested by school districts and units and what has been approved. So when we're talking about the curriculum, the social emotional well-being, social emotional learning, it's things like road to regulation, superflex, second steps, zones of regulation, PBIS supports. And similarly, the professional development, it often goes along with that curriculum. So if you want to implement a new social emotional learning curriculum into your schools that you otherwise wouldn't be able to fund, you would be able to purchase the curriculum and also provide the professional development. So if you wanted the professional development on second steps or superflex, what that professional development looks like. In addition to something like nonviolent crisis intervention, the nurtured heart approach, BCBA training, etc. I'm going to skip over to like sensory materials and supplies. So a lot of that is for social emotional well-being, social emotional regulation, some of that prevention, as you can see there, and then direct services, which were what I had mentioned before, those clinical counseling services for students with no insurance or clinical counseling for students who have insurance, but they can't cover the copay or related to COVID, day treatment, BCBA services, either through contracting with an outside agency, hiring internal staff, or having subscription or consultation for BCBA services. So there are some examples. And then assessments, anything with social emotional. The DESA has also been on there that can be added to that assessment too, but the social language development tests and brief SEL surveys. If you have any questions about things that have been covered, this will all be on the website as well, so you can kind of look it over and see. This is not a list that you're limited to by any means. This is just what the schools have asked for so far. But if you have any questions about it, feel free to ask. In that category, just in case you were curious, this is what was funded over the last year and kind of the breakdown of it. So you can see the bulk was the direct services, but also a lot of curriculum and professional development that were kind of linked together. All right, so looking forward to this year, what is the process? Many of you have already applied previously, and it's going to be a very similar process, but a few things have changed. The process overall, and I'll go into each detail, you'll apply, eligible schools will apply for funding. The application will be reviewed by the Behavioral Health Division to make sure that it's allowable expenses, funding guidance, eligibility, etc. If approved, you'll be notified by email. The notification of award will outline that total grant amount, what expenses are allowable, what's been approved from your itemized budgets, and that's when the efforts can begin. And then the Behavioral Health Division will begin developing a contract, which will outline those efforts in agreement. One thing that we ask that is different from last year, so I want to highlight it, that you would wait 45 days to apply again. So if you apply for behavioral health efforts, you are able to apply again. However, if you apply subsequently, like too quickly, we're still processing the contract, and so then that can kind of get muddled. So we just ask that you wait 45 days to apply again. And what I mean by that, like if a school is eligible for say $10,000, that's the amount they're eligible for. They have the option of applying for up to that $10,000 out of the gate. Maybe they have a strong sense of what they want to accomplish over the next year, what they want their efforts to look like. They can put it all in one application and ask for the total amount. Or a district may think, well, I know I want this behavioral effort now, but I'm not sure what it might look like in the middle of the school year. Maybe we're waiting on some things. So a school district, if they are eligible up to $10,000, they're certainly able to apply for an effort. Let's say they want second step curriculum and that will cost $2,000. They are able to apply for that and get approved and get contracted and then wait another 45 days and then they think, "Oh, you know what? We also would like a nurtured heart training." Then they can apply for that too and keep going until they've exhausted their eligible amount. Does that make sense? So it's really either way works for whatever works for your district. If you're able to kind of plan ahead and think, oh, I want to apply for it all at once, you're able to put all your efforts into one application. But if you really want to wait and see how the school year is going to go and apply as you need, you're able to do that as well. The reimbursement and reports. So we will require quarterly reimbursement requests and quarterly reports. And we'll go over that in a little bit. So in order to apply, this is what's a little bit different from last year is we changed it to an online form instead of having like a Word document or PDF document. So it's all online. So when you go to our website, that behavioralhealthnd.gov education grant funding, you'll see that you're able to click on apply now. I just pulled it up. This is what the first page looks like so that you can kind of see it's a form. I wanted to show you that there's an option to save and resume later. The pages just goes over that guidance, that information, and then there's a page on the application. So you can save and resume later. It'll send you a link so you can access it at any time before you submit if you are thinking about things or need to gather some information before submitting. Oops. And then just so you know, these are very similar to the questions last year that were asked. So the information that you need to provide on the application, other than your basic demographics of your school, your district, your address, your phone number, contact information, et cetera, you'll, in order to say what your proposal for your behavioral health efforts, we will need you to describe your population type. Are you the school, the district, the special ed unit, your service area, where this project is being implemented? Describe the school's leadership support. Describe efforts of collaboration with other regional school districts. We'll talk about collaboration opportunities in a little bit. Describe how this grant funding will be used to develop student behavioral health interventions. Describe who will be served by this grant, and then have a detailed proposed budget breakdown. And when we say like what interventions will be created or who will be served, we, this is an opportunity to be a tier one, to be able to support tier one, to support universal access either through universal screening or universal curriculum or interventions, but it also can be used for a tier three intervention if you're really looking at clinical services or certain subset of the population would be eligible to be for this program or these opportunities. It's really based off of what your school, your district, your unit needs, and we just want you to outline what your efforts will be. I don't know if I'm going I feel like I'm flying through it pretty quickly, but if anybody has any questions at this time, you know, feel free to ask a question in chat or speak up if you have any questions on this. As part of the application process too, because it is an online form now, I just really wanted to point this out. There's going to be a section that says upload a detailed proposed budget breakdown below. You can just choose a file. That file can be whatever is easiest for you. I think like Word, Excel, even a picture of your budget is okay as long as we understand the breakdown, as long as it's detailed proposed. This is what it looked like last year. So this is what I'm thinking of, having your service, what the amount is of that service, and then what's the total requested cost. So then you can break down, is your service nurtured heart training, $3,000, second steps curriculum, $1,000, break it down like that so then we can kind of see what it is that you need. What is your money going towards that supports the proposal that you just submitted on the previous questions? If that makes sense. Um, when you submit the application, you'll get a confirmation email. This is just a screenshot of mine, just so you can see kind of what it looks like. It'll just be, that your application has been submitted. And please wait 45 days until submitting another application to allow for that time for processing. In the interim, once it's been approved, you will receive a notification of award and efforts can begin at that time. If not approved, you will also be notified, but it's not likely that you'll just say, no, not approved. It would be something if part of it wasn't approved, I would reach out to you and ask for clarification or ask you to update it or say, for example, you had some great proposals and some great behavioral health efforts, but you also included in your item budget something about reading curriculum. While reading curriculum is great, that doesn't fit in with the behavioral health efforts. So I can still approve the application and just say it's all been approved except for the reading curriculum since it's not directly tied to behavioral health. What I'm trying to say is you can be approved. It can be approved in part, right? So I can say the some of these efforts will be approved, or I would reach out to you to ask for clarification or ask you to change your proposal so that it better fits our guidance and our vision. And then if you have any questions or need to make any changes, you can always contact me and we can talk it out or change it out depending on what's needed. And if, like I said, the 45 days is just to kind of wait for processing so things don't get muddled up. But if something changes, you can always reach out to us. Once your efforts have been approved and you'll have a contract, these are the dates. This is both for reimbursement and reports, just going to be quarterly each time. So quarter one would be any July to September efforts, and then that would be due the 15th of October. October to December efforts would be due in January. January to March efforts, it would be due in April, and April and June, it would be due by July 8th. So those are the reimbursement reports. If you submit an application, it would be whenever your efforts are approved until June 30th of 2022. So if you don't submit an application until October, then your reporting would start that quarter too. Fairly self-explanatory, I think. So what is the process for reimbursement? I think most of you are pretty familiar with this by now, the SFN 1763. This is what needs to be submitted quarterly, and I have those dates over in the corner again. What's important to note is that actual expenses are reimbursed. So we wouldn't pay for things before they happened. You would purchase them or you would pay for them, and then we would reimburse you for the services or for those purchases, depending on what your grant and contract look like. Keep those receipts and proof of purchase in case of an audit. If you have any questions about how to fill this out, again, you can reach out to me, but this is what you'll be filling out and submitting quarterly. Similarly, the report will be due quarterly on those same dates. And the reporting form is dynamic. So the questions you're asked will change based on your response. You only need to report on the areas relevant to your grant. So if you have a grant that you only ask for curriculum, it will only ask you questions about curriculum. Likewise, if it's about clinical services, it would ask you questions about clinical services. And this really is to capture what is working or what isn't working in the behavioral health school grant. What are barriers that you've identified? What are things you would have done differently, or what impact has it made, or what has gone really well? Just kind of gathering that information for us to make better and more informed decisions in the future. Does anyone have any questions yet? I'm going through this. So some collaboration. We have added a section to our website that says current efforts. Right now it says check back soon to see current efforts being implemented by the behavioral health school grant funding, because right now we don't have any applications in since the new the new year just started, July 1. But those current efforts will be posted on the website. So, for example, if a school was going to be providing AIM training, then we would say that what school, what training, and a contact person. So if you're looking at this and you're thinking, oh, I might want to do AIM training, then that would be a person that you could contact to say, either, was it worth it? Did you like it? Who did you book it through? Who did you go through? Or even to have some collaboration, like if one district wanted to provide the training and another district wanted to kind of to piggyback off that training and go to that training as well to help kind of reduce the cost and share some of that cost. So you can kind of see what efforts have been done across the state and who to contact about that just to make better informed decisions or connect. In addition, we're going to have quarterly meetings, and this is to share and collaborate efforts with districts across the state. So districts will be able to share what they've done so far in their efforts, as well as an opportunity for you to talk to other districts like, wait, how are you you guys know what you need to know. Like, how are you coding this? Or how are you handling this barrier? Those an opportunity to share and ask those questions. Or similarly, hey, we're interested in this curriculum or this training, and we want to see if you'd be interested too, and we can combine those efforts. So we're going to have 3 quarterly meetings, and these coincide right after each quarter but right before the reports and reimbursements are due. So it's about that like middle between when it ends and when it's due. So that's also a great opportunity for you to join if you have any questions about how to fill something out or how to report on something or something nuanced that comes up. You can certainly join and ask those questions for some technical assistance at that time. And those are optional. That's just a great way for you to connect and share some of the efforts that you've been doing. If you have any questions, we do have a frequently asked questions section on our website. That's just been a running list of all the questions that I've received over the last year on behavioral health school grants. So I encourage you to check that out if you have any questions, but also feel free to reach out to me because if you have that question, likely somebody else has that question. I feel like such a teacher when I say that, right? Like we always say that to our students. But I encourage you to ask those questions because then we can just update that frequently asked questions so that other districts can get those answers too.
Amanda?
And that is all that I have as far as the presentation. Does anybody have any questions that they want to go over that I can add? Anything about the application process or questions on efforts?
Amanda, this is Kyle Davison. Can you hear me?
Hi, Kyle. This is Laura. I can hear you. Amanda, can you hear Kyle?
So I'm just going to say something here real quick. Amanda probably can't hear.
So one thing to add, when your application has been approved, your efforts can begin, as I said before, at the time of the notification of award, and then your contract would be from that date and then through June 30th, or to June 30th, I should say. So from whenever you apply. Oh, I can't. I cannot hear you talking to me. Oh, I'm sorry. I was maybe talking over you. Wonder if I stop sharing.
So Amanda, I'll talk out loud again to see.
Yep. I hear you, Kyle.
Okay, so I'm something. So I appreciate everything everybody's been doing. The Department of Human Services, Behavioral Health Department, on the work on this program. As we continue to grow the Medicaid and we continue to work closely with behavioral health it just is really important that we get that data and that feedback as we continue to ask for additional dollars for the behavioral health grant in the next biennium to the legislature. So we really appreciate all the work and the ease of use. It looks like that has grown from when we just started a couple years ago. So really encourage people to get that information and that data and those use of funds. So again, we can bring that back to the legislature and continue to work and show the collaboration between schools and the Department of Health in addressing behavioral health. So thanks again to everybody that's been working on this.
Thank you. Yes, my audio works now. So thank you for adding that. And yes, that's another, I think I was saying with the reports, another great way to look at it. It's information we do need to share and share our efforts and to show what a great impact that this has made. Yeah. And I don't know, okay, was there any other question that I had missed when I couldn't hear you?
Amanda, this is Patty from Fargo. I went on the frequently asked questions and I saw the list of how much is awarded to each. And I think it was last year's list. And you said it's equal to Medicare. Do we make an assumption and just use what we know that to be, or do you inform us of that exact amount?
Well, thank you for letting me know. We do have an updated amount, so I will look over that FAQ again.
And I could be
Um,
wrong.
I wonder, let's see. Well, in Fargo may be very close to what last year's you might be very similar.
Right. And that's why I
Um,
was wondering, is there like a formal indication?
right. So that is where I had it in the frequently asked questions, so that would be the formal one, but I
Okay.
want to double check if that is it shouldn't be last year's
Okay.
numbers, but I will absolutely double check because I wanted to make sure
Yeah, I
it
was
is.
gonna say, it looks close, so I wasn't sure if it was the one we received last year, if it was for this year. So I just wanted to clarify that. Appreciate it.
Yes, I will look that up, just to be sure. And then to answer Jeff's question in the interim, the application window is open now. You are able to apply now. Mhm. So, and you go on our website and you can click apply now. It should be live. Let's see. Okay, I'm looking at the FAQ right now, and that is this year's numbers. If you think that there's an error at all, you can certainly reach out specifically, but those are the numbers that we've received from the state that are the Medicaid match numbers. And I'm wondering, Patty, if just Fargo is very,
I'm,
very similar to last year's
yeah,
numbers.
or it is possible that we had some recent updates to it. Can we talk about it separately? Could I just have a phone call with you maybe? And
Absolutely. Yep.
okay,
Because that's the numbers we get from the state. So I will double check
right.
that if there's anything that if there hasn't been a change or something.
Yeah.
Is that similar, Danica? Is it different?
I wondered the same too, if we had like an add-on at the end of June, like when were the numbers pulled, because that may make a significant difference.
Mhm.
Or is it this the number that it goes with through the whole year?
That's a great question. So, I can double check with the state to be sure, but from my understanding then, because the numbers are pulled in June, but then the June of this year is tagged on to the next year.
Okay.
So so instead of it being from July to July, I believe then it would be like you're seeing June of 2020 included instead of June of 2021, because June of 2021 will then be on next year's because of the way that when they pull. I will double check that to be sure, and I'm happy to reach out to both of you just to make sure that those numbers are that are accurate with your records as well. But those are the numbers that we received.
And that's a good question, because I would think I would think it would come right off the school voucher, because it's the matching dollars that come right off the foundation on the school on the school formula voucher. So, but if they change it to go to June, that may be something I'm unaware of. Because that's the audit trail for the Medicaid match, is the final year, the school voucher, the school foundation pay worksheet, and that would come right from DPI.
Yes, yep, and that's where we receive the numbers straight from DPI, and then
Adam would have those.
yes, that is who we received. I'm sorry, I'm just looking up if it says specifically, because that's where we get our we pull it directly from DPI from Adam.
But he might not have June done yet, though. So, but anyway, you check on that, Amanda.
I will.
I mean,
Yes.
it's awesome.
Yeah.
Yes, because that is, I mean, that's definitely, we want to make sure it's up to date and accurate, and then it's matched to the Medicaid reimbursement. So, yeah.
Yeah, it's just good to know too if the poll date is, because we had a large sum come in June. So if the poll date ended in May of, the last day in May, and now this year's June will be on next year's, we just know that would be a bigger budget. So
Yes, I am fairly confident, but I will definitely double check just to make sure that that's the most up to date and accurate, and let you know.
Thank
Of course. Yes, Tracy. So, Tracy had asked about, last year her special education unit had separate dollars identified. And then this year it's her unit, but not her in her district. So how it is written is the way that I don't know if you had changed the way that you had done Medicaid reimbursement, but again, that's the list from the Medicaid match that I received, so that it would be that whole unit is that amount. It doesn't, so if it's written that way, it doesn't need to be delineated as it was last year, if that makes sense. Because I know for some of your districts or schools, it might be a little confusing, just because you have a district, or you have a unit that might encompass more than one district, and the district might have dollars and the unit might have dollars, and it needs to go back to who did the Medicaid billing, so who is listed on there. But if it's just the unit, then that's the one unit that is eligible.
Thank you. It makes sense. It'll
Okay.
make it a
It might
lot
help
easier.
Yeah, it might be a lot easier
Yeah,
for you
but-
to be able to collaborate or what have you. And certainly you are able to collaborate across districts, but just I wanted to be clear that if you did, it would just, the money would go back to the unit who is eligible. So if one, if you wanted to combine to do a training across district, that would be a great opportunity to do so, but then it would be splitting the cost, and it would go back to the district who requested. Does that make sense? Like, you wouldn't submit one application for
Makes
multiple
complete
districts.
sense.
Yeah, especially in your situation, since when did you add the pull dates? Oh, will I add? Yes, I can add the pull dates to the FAQs. That's a great, I will add it on there, so that if I'm not able to personally reach out to you, or you reach out to me about making sure that it's up to date or accurate, I will put it on there. I will reach out to Adam to make sure exactly what that is. I think I have addressed all the questions in chat. Again, I think I said the application window is already open now, and then your contract date will be from when it's first approved until June 30. So that could be as soon as, now until June 30, or if, like I said, it's really up to you if you really want to be proactive and think about the year and apply for all your efforts in one application, or wait and see what your needs are. One thing I don't know if I made it clear, we do have a budget of $1.5 million this year, and it is kind of a first come, first serve until the funds are exhausted. So each district or unit has a amount that they are eligible to receive. But if the funds run out, as far as we will continue processing the applications up to that 1.5 million.
So, and again, that's to my point, is why we need to do a good job with the data and the projects that we use it on, because as we work with human services, and I know I'm repeating myself, but as we continue to expand services and try to get schools additional resources for these direct services, many of which aren't covered, we want to have that evidence that the work we're doing is work, the work that the investment this is happening in the schools is valuable. And so if we need to get it to 1.8 million a year or 2 million a year, that we have some evidence to show that's a good thing.
Absolutely. Yes. We want to know what the need is and that it's addressing that need. And that's why it's a little open ended. Like, we have the guidance and we have that it's for behavioral health efforts. But really, we know that what efforts are needed within your schools. And that's why we want to hear from you as far as what isn't being covered that you need to have covered. Is it additional SEL curriculum, or is it additional clinical services? Like, what is it that you need to best serve your students for their emotional, social wellness and behavioral health needs? But if you ever have any questions about what could be covered or what are allowable expenses, there's some guidance, there's some frequently asked questions, but also I love brainstorming and problem solving. As many of you know who have talked to me about some ideas of, like, well, we're thinking about this or thinking of that. Like, feel free to reach out to me even before you apply if you want to see if something would be a good effort in your schools.
Amanda, quick question, and I know we've talked a little bit about it in that arena of like co-pays for kids, and we do a lot of partnerships within our community with West Central, our human service center, and they come on site and service students through our mental health collaborations. And one of the wonders I had last year was, can they become a vendor so they can just bill, like, so that the money isn't flowing through the school district, so that like they send us the student's bill and then we turn around and pay? Can they be a vendor listed on our application so that like West Central Human Services could fill out the reimbursement form for that student services, and then the school district is not the middleman? Do you know if there's been any discussion around that?
We've discussed it a
Okay.
little bit, and I know Laura and Pam are on the call, and so if you have any thoughts or wanted to speak to it, I'd love to hear any of that input as well. But the funding does need to go to the schools because that's who is eligible for it. But I understand the concern of, like, being that third party, and so I think possibly one kind of workaround about the middleman is, I know it's not quite the same, but if would an REA be able to fill that role or something, like have a billing for that reason? But it wouldn't be the vendor directly, from my understanding. But yes, I'm seeing Pam say that we can follow up on that. So I know that that's been a question about, how other districts have been doing it and how they've, because then they're paying for the services and then getting reimbursed.
Okay. Thank you.
So I will add that to follow up on if there's any additional ways that can be done.
So again, though, and I know this is a rabbit hole going down, and I don't mean to do that, but since if Pam is on the phone, or, that match comes out of a different budget, though. So if there is a third party billing, that match comes out of a different budget within behavioral health or within the. But again, I'm going down a rabbit hole. I shouldn't do that on the middle of a July afternoon. So.
Yeah, understandable. It is because, yeah, I mean, you have that sustainability built in where the third party is billing, but then when there is that gap, and I know that you're using it for those gaps in services, and then how to be reimbursed because, right, the way that it's set up right now is that you be reimbursed for actual expenditures rather than paying, but then it goes directly to the school. So we will follow up and see if there's if there's any other alternatives for that.
That other question I would have then is we've explored routing it through our foundation where like it gets billed to our BPS foundation and then the foundation pays for it, but they have a 2% charge. Is that something that we can write into the grant to help cover like their 2% admin costs?
That is oh, go ahead.
That's okay. This is Pam. I was just going to say, I think that we can take this offline and kind of see if there's not other options. As Kyle mentioned, I think looking at the multiple funding sources, there's got to be an efficient way for us to make sure that we're getting services without using the wrong money in the wrong place.
Sounds good. Thanks.
Definitely making note of it so we can have further discussions. Does anybody have any additional questions? So yeah, just let me know if you have any questions or concerns as they come up. Feel free to reach out to me, or like I said, look at that frequently asked questions, which I'll regularly update. So if you do ask me a question, I'll likely throw it right on there, like about the Medicaid match and those dates to make sure that that's accurate. If you have any questions filling out the online form versus the old Word form, just let me know too. And yeah, I'm excited to hear some of your proposals, and I'm excited that you are thinking ahead for next school year already, and I really appreciate you joining us in the middle of July to discuss behavioral health for our students next year.
Thank you again for all your hard work on this. We really appreciate it.
Yes. All right. Well, I think that's everything. So again, don't hesitate to reach out to me, and I look forward to hearing from all of you. So have a great day. Have a great rest of your summer.